And thank you. So we are recording. Thank you so much for joining us, and I apologize for being late. We had some last-minute inevitable technical difficulties, including a power outage. So thank you so much for joining us this afternoon or in the morning, depending on where you are. My name is Molly French. I direct public health for the Alzheimer's Association. And I'm joined here by my colleague, John Sheehan. He's the Associate Director for Public Health here at the Alzheimer's Association. And we're so delighted and honored to be able to partner with the National Indian Health Board in offering this webinar. And we do greatly appreciate the support of the Centers for Disease Control and Prevention, who enables us to be offering this webinar, but more importantly, was a key partner with us in terms of developing the Healthy Brain Initiative Roadmap for Indian Country. Just as a reminder, we have muted everyone when you've entered, all the participants, so that it just eliminates some of the background noise. And because this particular time wasn't convenient for everyone, we are recording the webinar so that other people can catch up with it when they're on another time. After today, I will send everyone just a simple PDF of the slides if you wanted to refer to those, and then as well as a link to the recording. And really encourage you, if you know of other people who may want to see the webinar, they can go ahead and use that recording. So thank you again for joining us. We're very honored and pleased to have you with us today. And this slide just shows hopefully what you're seeing on your screen or close to it, but I wanted to point out the way, just because of how our Blue Jeans platform is structured, we're only able to take questions or your comments via chat. But just because we have that one channel, the chat available, doesn't mean we don't want to hear from you. And actually, in my view, hearing from the webinar participants is what really makes a webinar great. So please, at any time, use that chat function to email us your questions and comments, and there's a period at the end where we'll be covering those. If you don't see the bar with the chat on the top of your screen, just move your mouse up towards the top, and the Blue Jeans menu bar should drop down so you can see that chat function. And then finally, we will be, after the webinar closes and when I send a link out with the webinar recordings and the slides, there will be also a request if you would please just take 2 to 3 minutes to do a short feedback form for us and tell us about this webinar, because we want to do a better job always in trying to serve you. And I'm now pleased and honored to be able to turn this over to Carolyn Angus-Hornbuckle. She is now the Chief Operating Officer for the National Indian Health Board and a member of the Mohawk Nation. Carolyn.
Thank you so much for that kind introduction, Molly, and good afternoon, everyone. I am delighted to be with you all today and to be with some of our really wonderful partners, Molly over at the Alzheimer's Association, Lisa from the CDC. CDC has been a wonderful partner to the National Indian Health Board over the last 6, now almost 7 years. And we are very, very glad to have our partners. The work that we do at the National Indian Health Board is not done alone. It is done in partnership with our funders, with our partner constituents, and also with all of you out in Indian country. And we are very honored to have the role that we play in this work. And that is really one of a national organization that is located in Washington, D.C., with a core goal of advocacy and outreach and education to ensure that our decision makers, our policymakers in Washington, D.C. understand and hear the tribal perspective And all of the work that we do at the National Indian Health Board is work that we bring forward from you all in Indian country. As my CEO likes to say, nothing happens at NIHB that isn't directed by the tribes in Indian country. And we are very, of course, honored and privileged to have that role as a partner with you all in outreach and education. And going on to this topic, I think that this is a really apt example of work that is extremely important. It is work that we care deeply about at the National Indian Health Board. We know that Alzheimer's and related dementias are topics of concern out in Indian country. We also know that there is not a lot of work that has been done in this area historically, but we are really delighted that our partner CDC and our partner Alzheimer's Association are looking to make sure that tribal communities are included in this work and make sure that tribal communities have resources that they need to address these issues and to support caregivers, and really just to make sure that Indian country is an important and included population in the work to make sure that information is shared and that people have the resources that they need. This webinar is going to do a few things. We are going to share information about Alzheimer's and other dementias. We are going to identify some of the connections between dementia and its relation to diabetes and heart disease. And we are going to also try and illustrate and share out information and examples about how dementia is not only impacting one generation, but actually is an issue and a topic that everyone in all generations are concerned about and that feel impacts from. We also want to share out an important tool, and NIHB has been very, very privileged to be a partner to the Alzheimer's Association over the last year to share out a really wonderful product, which is the Roadmap for Indian Country. And that product is a wonderful tool that has packed with information, packed with really excellent guidance. It's something that the Alzheimer's Association developed with the help and the input from the National Indian Health Board, some of our partner organizations, and many of you across Indian country. NIHB is really glad to help lift up the roadmap and share it out, and we have done a little bit in that space over the last year, and we're looking to make sure that our partners, all of our partners across Indian country, whether they're working on this topic, whether they're learning about this topic, or whether they are deeply engaged in this topic, have an opportunity to come together and learn together and support each other and to use this really excellent tool. So that's a little bit about the webinar today. I would also just mention that the National Indian Health Board is really committed to this work because it's important, because there are so many disparities in Indian country, and really chronic issues are some of the areas that are most in need of resources and attention. But then I do want to also mention that there's another very important reason for NIHB to be committed to this work and interested in seeing it succeed and tools being shared. And that is because as a population, and of course we have 573 federally recognized tribes, and every tribe is unique. But one thing that I can say with some assurance is that across all of our tribal nations, elders are an extremely important part of our community. They are the keepers of wisdom. They are the teachers of language. They are the keeper of life ways so that our next generations and our young folks coming up can actually really understand the culture and preserve the culture and have that sustaining force in our lives. And we want to make sure that our elders are able to continue to play that most important role in our communities. So that is one of the reasons, among many, for NIHB being very interested in this work and very committed to this work. I am going to turn it back over to Molly in a moment so she could introduce our presenters. But I do just want to mention and provide a reminder that we ask if you have questions or comments or thoughts to share, that you please type them into the chat box, and we will designate some time so that we can actually have some discussion and address questions and have some interaction. But as Molly mentioned, we have to use the chat box, and I will help share those questions out and direct them to our presenters. So with that, I will go ahead and turn it back over to Molly so that she can share some short bios.
Oh, thank you so much, Carolyn. Well, our first presenter is Dr. Blythe Winchester, and she has just been a vital advisor for us in our recent Healthy Brain Initiative Roadmap series. And just so full of knowledge and wisdom. She currently is the U.S. Indian Health Services Chief Clinical Consultant for Geriatrics and Palliative Care. And she's also medical director of the Tasali Care Center at the Cherokee Indian Hospital, located in Cherokee, North Carolina. Dr. Winchester is a board-certified geriatrician and a member of the Eastern Band of Cherokee Indian Nations. And our other presenter is Dr. Lisa McGuire, and another just longtime partner for us at the Alzheimer's Association. Dr. McGuire leads the Centers for Disease Control and Prevention, CDC's Alzheimer's Disease and Healthy Aging program. She has her PhD in Lifespan Developmental Psychology from Bowling Green State University, and she joined CDC in 2004. And I'll turn it over in just a second to Dr. Winchester, but my colleague John pointed out that instead of chat, you may see Q&A, and that function may either be at the top of your screen or at the side. If you don't see it, move your mouse around to the perimeter of your screen, and hopefully that will pop out. Right. Thank you so much. And Dr. Winchester.
Thank you so much for that introduction. So I'm in a busy clinic. I don't have an office, so I apologize if you hear any chatter or announcements behind me. I'm pretty loud, so hopefully I'll drown out anything that you may hear. It's a privilege to be able to share this information with you today. I know that you're a varied audience, so I apologize if anything that I cover is stuff that you already know. And thanks again for allowing me to join. I have about 18 minutes to go through, what dementia is, why it's a priority in Indian country, and what are the priority areas that we're going to cover. So I also talk very fast, and I'm thankful this is being recorded, so that way if you miss anything, you can see it later. Next slide, please. So I can't talk about Alzheimer's disease and other dementias without going over some of the signs. You can find these everywhere. They're all over the Alzheimer's Association website. So I always mention these in almost every talk I do on dementia. 10 signs of Alzheimer's disease include memory loss that affects daily life. That's actually a very key phrase here, that it affects daily life. I give some examples on each of these. For affecting daily life, it includes forgetting events, repeating yourself, relying on more aids to help you remember. Trouble with planning or solving problems is the next one. So maybe you are not able to handle your bills well, or you're having trouble with a recipe that you've done forever. Difficulty finishing tasks you're used to doing, so just not being able to follow through with things that you could do before that were quite easy for you. Confusion with time or place, so trouble understanding that an event is happening later or losing track of dates. Next slide, please.
Dr. Winchester, it's Molly. There is a small delay, as you can see. But why don't you go ahead and we'll let the slides catch up to you.
Yeah, I'll go ahead and so other things, trouble understanding visual and spatial relationships. So that includes kind of trouble with balance or tripping over things, spilling or dropping things, The next one is new problems with speaking or writing, and that can include trouble finding a word that you're looking for or trouble following a conversation, kind of forgetting what you're saying mid-sentence. The next is misplacing items, particularly putting them in strange places. So putting car keys, in the refrigerator. The next one is decreased or impaired judgment. This is a huge one because we have a lot of examples, say, of elders being targeted by scams, and because of their impaired judgment, they're not easily able to recognize that they're being targeted. Withdrawal from work or social activities, so someone's gone to church forever, but all of a sudden they don't want to go. And then changes in mood and personality, which can often be one of the first things that we see, particularly being apathetic or just not having the same level of interest that you did for something before. Next slide. So I put as kind of a bottom line, what does dementia or neurocognitive disorders, the fancy term that we use for this, what does it do? It causes problems with remembering, cause problems with paying attention or focusing, making decisions. It can cause difficulty with understanding, and then language. And you can imagine on a regular basis how many of these things you're using. So if we pay attention and kind of look for this, you'll see this in people, what you're talking to on a regular basis. Next slide. I have to mention here the different kinds of dementia, because the number one question I get asked is what's the difference between Alzheimer's and dementia. And as you can see in this graph that I love using, Alzheimer's is just a piece, of all of the different dementias. It's just one type out of several different kinds that you can have. It is the most common. So even when I'm talking to providers about diagnosing dementia, I'm like, even if you have to, make an assumption or seem, what seems to be the most common, it's going to be Alzheimer's. Even if you kind of have to make a guess before someone follows up, that is the one that you decide because it's the most common. Vascular comes in close next. We know about this in Indian country, particularly because of all of our heart disease risk. And mixed is when you have more than one different type. So I mentioned these three because these are the three most common ones that I see in Indian country. Next slide. I show this because it helps me emphasize on this graph why it's so important for us to focus on trying to get early diagnosis or catching people when they have what's called MCI, which is mild cognitive impairment. So they are starting to have changes, but it's not affecting them on a daily basis. And we are trying really hard through these campaigns, through these roadmaps, through research to try to help people understand that early diagnosis, catching anything early is key. And I'll talk about a couple more reasons why that's so important. Next slide. I did want to mention, I used to, when I talked about this years ago, I would always say, we don't have any information about, our indigenous populations. We don't know, and that's not true now. We are getting more and more data about how, yes, Alzheimer's and other dementias are issues in Indian country. Yes, we need to pay attention to this. Yes, it's fairly common and sometimes more common in our populations than in others. I present this in the next couple slides as information to support this. This was a great Kaiser Permanente study that looked at incident cases of dementia over a fairly long period of time in Native Americans. Next slide. So it was identifying, incidents among self-identified American Indians and Alaska Natives, and they found that the incidence in this population was second only to the incidence among African Americans. This is very important because in the past, because there wasn't data, people would assume, that maybe we had less dementia in our populations than others. But this was the first to kind of show, no, that's not the case. We have dementia just as much as other populations, if not more so. Next slide. This is another example looking at prevalence of dementia in First Nations people. And they also found, that there was a higher age-adjusted prevalence in First Nations people versus non-First Nations. And it was also disproportionately affecting younger people and males in First Nations. And I'll tell you, I think that will be one of the areas that we focus on next is examining dementia in our younger people or kind of different onset of this based on the risk factors that we have, which I'll talk about. Next slide. This is age-adjusted death rates, and the reason I show this on here, this is from 2014, so it's not it's not very old, but it does show, if you look at the U.S., all races line at the top, and then the other ones are the American Indians and Alaskan Natives, adjusted and unadjusted. And even for the adjusted, we are kind of running in this same exact trend, which is weird, but it does show that we are having the same, increase in death rates. It's just another example of why it's important to pay attention to this. Next slide. I mentioned this before when I was talking about what we'll be looking at in our tribal populations for risk factors. If you look at all of these medical illnesses and look at the ratio of how much we have them compared to other populations, you can already see that it should be obvious that we have higher risk for dementia. Even looking at the diabetes alone, unintentional injury sometimes can include traumatic brain injury, which is a huge factor and a big contributor that I see in people who develop dementia from having traumatic brain injuries in the past. But this just kind of gives you an example that we have higher risk factors anyway. Next slide. I like this slide because it does show that in every region of the Indian Health Service, there are persons with dementia diagnoses. So this is looking at some kind of old data. It's from 2009 to 2013. But I think it's very important. This is showing up. People are being diagnosed. And I bet if once we get finished with the data that I'm looking at currently that's more up to date, it's going to show a huge difference. Next slide. So American Indian Alaska Natives have the highest prevalence of cardiovascular disease of any racial or ethnic group. We also have high rates of disability, especially compared to whites. And only 22% actually live on reservations or trust lands. 60% live in urban areas. And I think that's important to mention when you're talking about outreach and how we're going to get access to these people to provide resources to them. Next slide. Part of what I'm talking about is a link now between dementia and other chronic illnesses, which we emphasize more. We emphasize the link of it to diabetes, to heart disease, all of these things. So one of the main things I talk about is its link to diabetes, and these are just some examples of why that link occurs. Why is it that people have diabetes yet more dementia? Well, it's because they can have blockages. They can have infarcts. They can have strokes. They can have non-blockage lesions that affect the white matter of the brain, which contributes to dementia. They can have problems with not getting enough circulation to their brain, which is that hypoperfusion. They can have bleeding, or they can have swelling. So all of these things are part of that link when you say, oh, why would you have diabetes and have a higher risk of dementia? And I'll talk more about the inflammation in a second. Next slide. There are also evidence of other things that kind of link the two. For example, having decreased insulin concentration is directly linked to deficits in cognition and memory. We also know for sure that the higher your sugar runs on a regular basis, the worse that affects your cognition. And then if you already have some kind of age-related impairment, which can happen, with attention focus, diabetes makes that even more exacerbated. So you'll have more problems with processing speed and things like that. Already we know that people with diabetes have nearly twice the risk of developing a neurocognitive disorder. So even without taking into account, the control of your sugar and everything else. Other risk factors include advanced complications with their diabetes, having it for a very long period of time, or taking insulin itself. So as you can see, looking at that, there's a lot of different links between dementia and diabetes. And if we focus more on those, then I think we'll get more investment in kind of helping with brain health. Next slide. This talks about inflammation. I love this slide. As you can see with what we're talking about with the brain, sugar can rewire the brain's pathways. Diets full of processed and sugar-heavy foods can increase the risk of depression and can affect everything else related to your brain based on what I said, a few slides ago. And I think that inflammation is becoming more and more of a focus in looking at not just native population chronic disease, but for all, populations. So that's something that I talk to people about too as a factor in affecting their brains. Next slide, please. So I did want to briefly mention, because there is a very strong link between heart disease and Native people, but because it is very important to take into account our cultural considerations and the fact that, in a study that looked in the 1940s to 1950s, there were 10,000 admissions to a Navajo hospital. Not one of them was for an acute myocardial infarction, otherwise known as a heart attack. So I think it's very difficult to look at these risk factors and not think about those cultural associations and how acculturation has contributed to the rising, rates of all these illnesses. It's why we get very excited about the special diabetes program for tribal populations and all of the tribal programs that get created, based on the community needs and cultural considerations to try to help with all of these risk factors. Next slide. I wanted to mention the Healthy Heart, Healthy Brain campaign because I've kind of mentioned that phrase already. I put a link to it on here. It really has a lot of resources for providers and for patients for trying to help you understand, that link between a healthy heart and a healthy brain, so we can get people, more invested in changing these risk factors. Next slide. This one is just an example of one of their handouts that they have, so you can feel free to look at those. Next slide. I mentioned before that I talked about early diagnosis. Enough can't be said about the importance of preparation and avoiding crises and empowering people to feel like they have more control and be able to change things to improve, their future. So all of these, I think, are very important when we're talking about early diagnosis. Next slide. If we can talk to people about how their brain is being affected, by their risk factors, I've found that patients are much more willing to be engaged in what it is that I'm telling them about. They're more willing to talk about exercise and make changes if they understand that it, could affect their dementia risk. Next slide. The earlier you receive the diagnosis, you can receive symptom management through medications or other interventions. Safety is a big issue, so we can talk about that early so that there isn't a crisis that pops up later. And then obviously helping you to plan for your future. Legal issues, things that can come up as capacity changes for patients. All of these are factors in early diagnosis. Next slide. Another thing that we talk about is as a priority is caregivers and caring for them. This is a huge issue for me, and we have information in the roadmap about programs that are taking place to try to help caregivers, because they're the ones that are really the life force in trying to help with quality of life and function, for those who are affected by dementia. So that's why it is so important. So this just kind of is example from a study about really how the behaviors and the those abnormal behaviors that can pop up can really affect particularly a daily diabetes care routine. So when you have diabetes and on top of that have dementia, this really does affect caregivers and the stress that they experience. Next slide. So this is just an example of a community program that can help for caregiver support. And one of the things I mentioned, in the roadmap is that, and something that I love about it is that there are tons of examples about what tribes are doing. And we know, if you work in Indian country, the thing that we do the best is indigenize something. We can take a program that's being used and just really do a great job of adapting it. And I like how this is presented in the roadmap, because it is examples of things that if you look at it and say, oh, that would work really well, here that is an option, that you have. Next slide. So another example of kind of an organization and a caregiver support program is the National Indian Council on Aging, or NICOA. They're really a big force in terms of elder care and elder priorities across the nation. They have large conferences where lots of elders are gathered and voicing, what it is they need. They've created this Savvy Caregiver program, which is free and accessible, and it's a really awesome resource to help for caregiver support. So that's just two examples, and I think that there'll be a lot more work in the future for caregiver support and how to make that happen on a community level. So that's kind of like an overview, of what dementia is and kind of why it's important in Indian country. Why should we be talking about it? Why should we be dedicating resources and research and supporting these other large organizations, like CDC and the Alzheimer's Association, who are so willing to help us, to be able to address this issue in our communities. And so I appreciate, your time. And I do have in the next slide information about, oh, sorry, it's on there for contacting me. So please feel free if you have any further questions to reach out. Thank you.
Thank you so much. We really appreciate that information. We're going to hopefully get some questions, and we can follow up some of that wonderful information and have our attendees ask some questions and delve a little bit more deeply. But before we get into the question and answers and discussion, we are going to have Dr. Lisa McGuire from CDC share a bit about the CDC's role in this work. I've already mentioned that CDC has been a partner to the Alzheimer's Association and to the National Indian Health Board, but also CDC has been the driving force behind the Healthy Brain Initiative, which has had a number of different components. CDC's work in that space has been surveillance, communications, resources to communities and publications, and also the Public Health Roadmap series. And we'll go a little bit more deeply into that aspect, but just to kind of give a little bit of a preview, the agency has created, with partners, has created some wonderful roadmaps for different communities focused on all kinds of aspects that you will hear a bit about. Lisa will share a little bit about that. But then there was also an identified need to have a roadmap for Indian country that would specifically look to address concerns that had come up in relation to Indian country's experience with Alzheimer's and related dementias. So Dr. McGuire will share a bit about the roadmap and how it was developed, and then also share a little bit of tribal work that has been done in the space, an example of some work that is really pretty inspiring and illuminating, and then also share some of the data that the agency has gathered. And we all of the presenters here are hopeful that the information that we're sharing, of course, will help to inform your work, but also we're hopeful that you will share the information out and share our contact information, because we do want to make sure that if people are working in this space and they want to have more data or are looking for specific data or looking for specific tribal examples, that we can help be a guide and bring you to resources that might help you in your work. So without further ado, I will go ahead and turn it over to Dr. McGuire.
Thank you very much, Carolyn. I'm very privileged to be with you this afternoon to share with you some of the activities that we've been doing at CDC. So the next slide shows you some of the data that we have available at CDC for American Indian and Alaskan Native adults. So CDC has a data collection system. It's called the Behavioral Risk Factor Surveillance System. And it is the world's largest continuously operating telephone survey. And for many states, it is the only source of health-related and health behavior data that is available. Our program supports two different sets of questions that we call modules. And you can see those on the screen here. One of them is subjective cognitive decline. So we ask people in the past year, has your memory gotten worse? And once again, Dr. Winchester pointed out, has your memory worsened to the point that it's impairing your daily functioning? And that's what we're getting at here. And then we ask people, how specifically has it interfered with their daily functioning, as well as we ask them if they've talked with their healthcare provider about the symptoms that they're having of the memory loss. We have a series of different types of infographics. You see two here on the screen. We have them for the U.S. or for the nation, where we have 49 states, D.C. and Puerto Rico. We also have state-specific available for your state, as well as we have them by race and ethnicity. So here you're seeing the ones that we have available for American Indian and Alaskan Native adults. The second set of questions that we have available are on caregiving. So we asked people if in the past year, if they've provided regular care or assistance to a family member or a friend who has a health problem or a disability. And you can see here, we see that 1 out of 4 American Indian and Alaska Native adults indicate that they have been providing care to a family member or a friend who has a health problem or a disability. So people indicate if they are a caregiver. They also tell us a little bit about their caregiving situation, how long they've been providing care, how often they provide care during a week, and the types of activities that they help that person with that they're providing the care. So please check out these materials on our website. We can provide hard copies of the American Indian Alaska Native infographics if you would like them, but they are free and they're also downloadable and they can be printed from our website as well. We would love to see as many people as possible utilizing that information because we do know that there are limitations in data, but we do have some data available for many people who were surveyed. There's 450,000 people who were surveyed annually on the BRFSS. The next slide is talking about our roadmap. So I'm going to tell you now a little bit about the roadmap, how we developed it, why we developed it, and actually what is included in it. So our insight, so building the roadmap, we got lots of different information and content and feedback, and we listened to lots and lots of different people. We listened to people from regional tribal health boards and their members. We listened to different tribal leaders. We worked with tribal aging service leaders and many through the Title VI program. We also worked with tribal governmental officials through Indian Health Service as well as other organizations. We had a very strong partnership with Dr. Blythe Winchester, who was a tremendous asset to us content-wise, as well as the National Indian Health Board, which really helped us stay focused and really target our product to the audience that we were intending that could actually use this information. One of the things at CDC that we're always very concerned about is developing materials that will be used. We don't want to develop a pretty document that is going to go sit on somebody's shelf or just make its way into their trash or recycling. We want to get content out there that can resonate and really improve the health and well-being of the people that you work with and you serve, as well as all people that are residing within the U.S. So why did we develop a roadmap for Indian country on the next slide? So really, this roadmap for Indian country, we have, as Carolyn pointed out, we have a series of roadmaps. So we have developed a series of 3 roadmaps for state and local public health historically. And when we were revising that roadmap for state and local public health, we were looking at different groups and who was using and who was implementing for improvement the actions that we've included in our roadmap. And one of the things that we noticed is that a lot of tribal communities were not utilizing the roadmap. So we started to scratch our heads and talk to colleagues and friends and partners and try to investigate and figure out why. And so many of the reasons that we figured out why were some of the various different disconnects between the way public health and healthcare do work in Indian country. So we set out to develop what we thought at that point was like a 5-page document that would be a companion guide to our state and local roadmap. Once we started listening and learning and investigating and talking with different consultants and getting feedback from people, we realized that this wasn't a simple redo. This required us really to rethink and reframe what we were doing in a way that embraced the unique strengths and priorities and practices of Indian country to really develop, once again, a product that is meaningful and useful. So we've developed not a 5- or 6-page document. I believe it's closer to a 50-page document, and I'll highlight some of that information for you. So the next slide, please. So our roadmaps are organized around the essential services of public health because CDC is a public health agency, and we know that the way public health typically gets done or the way public health departments think is consistent with those essential services of public health. So you'll see that we have carried through some of those essential services of public health, and our roadmap is organized around 3 of those. So the first one is educating and empowering communities. So what we are encouraging communities to do and to learn about from experts such as Carolyn Hornbuckle and also Dr. Blythe Winchester is to figure out how to educate your communities about brain health. So we don't just mean Alzheimer's disease and dementia, but we also mean what kinds of things can you do to keep your body healthy that's also going to keep your brain as healthy as possible. And also, if you're starting to notice some changes in your memory, to really reach out to your healthcare provider or your doctor to talk to them about that, to see if there could be some treatable cause for some of those changes that are going on. Also within this educate and empower, we're wanting to increase utilization of programs and services that really do support the health and well-being of people in Indian country, as well as those who might be providing care or assistance to them. Help families be able to plan for the future and really encourage leaders within the community to support the public health approaches to dementia. Next slide, please. So the second one of those essential services of public health is to collect and use data. So I started out my talk today providing and showing you some of the information that we have available from the Behavioral Risk Factor Surveillance System. So what CDC is encouraging people to think about is when you're trying to understand, we know that everybody has limited resources, and there's a lot of important needs and demands within every community. But to look at information that you have available to you to help make some decisions about setting priorities. And so what we're hoping is we're wanting people to see really how dementia and caregiving do impact their community, and so they can make some decisions about where to act or how to act in ways that's really going to improve the quality of people's lives within their communities as well as their health and well-being. Next slide, please. The next slide talks about the third of those essential services of public health, which is strengthening the workforce. And by strengthening the workforce, we mean this very broadly. We don't just mean doctors such as Dr. Winchester, but we're looking at all people who are providing health care and health type services and making sure that they are educated about what brain health is. What can we do to manage other health conditions or chronic health conditions that will help people either improve or maintain their brain health, as well as a true understanding of what those 10 signs and symptoms that Dr. Winchester showed you, what some of those are, but to illustrate the differences between normal memory loss that people have as they get older versus the memory loss and changes that can have a pathological cause to it, such as Alzheimer's disease and dementia. And also to recognize the tremendous service of caregivers and how valuable they are to really helping people maintain their independence as long as they possibly can. And also, so for providers are aware of the importance of helping caregivers maintain their own health and well-being too. Next slide. So one of the great examples that we're seeing in the Pyramid Lake Paiute tribe is we see the community in around that tribe's working to become dementia capable, which occurs by increasing basic awareness of dementia and having a community understanding of people affected by the condition. The goals of this program include improving and promoting education, engagement, and peer support among persons who are living with dementia and their family caregivers. Also to increase community awareness about the warning signs of dementia, promoting resources, improving knowledge, and education of the community. And the third goal is to expand supports and services for caregivers. Next slide. So at CDC, also in partnership with ASTA, which is the Association of State Territorial Health Officials, and IA Squared, we worked with CDC's Division of Heart Disease and Stroke to really help get some messages out, to really drive home the message of how important, maintaining your health, heart health is to maintaining your brain health. So we worked with a bunch of wonderful consultants who helped us develop posters and flyers that you see illustrated here on your screen, as well as a multiple-page provider guide. And the provider guide talks about some of the important things related to blood pressure management and heart disease and diabetes that really can help reduce a person's risk for Alzheimer's disease and dementia. There's also on this website, you will see there's a series of different radio announcements. Some of them are 30 seconds, some of those are a minute long, and there's a series of videos, and we had some articles that did also appear in Indian Country Today. So these materials are free. They are also downloadable from our website at cdc.gov, as well as from ASTA's website. And we also can help you obtain copies of those if you would like to distribute them in your communities. We've received lots of really good feedback on them, and I will say that some non-tribal communities have come to me and said, hey, we don't even have anything like that. So that's one of the things that we're working on at CDC, is to try to integrate the brain health messaging into other chronic disease messaging for other populations of people. And next slide. Thank you very much. I encourage you to stay connected to CDC. If you go to our website, cdc.gov/aging, you will see on the left-hand side a box that looks like the box you see here on the left-hand side. If you enter your email address in, you will be signed up for our newsletter, which we send out a couple times a month, and you will get the first opportunity to see any new products and materials that we have available, and we only will send you a couple emails a month, not daily email. So once again, I thank you for this opportunity. And next slide. And if you have any questions, my email address is on this next slide when it shows up. So please reach out, and if I don't know the answer, I know people who know the answer, and we'll make sure we get back to you quickly. Thank you very much for the opportunity to speak with you today.
Thank you so much, Dr. McGuire. So this is Molly French from the Alzheimer's Association, and before I flip it back to Carolyn, I did want to just point out a couple other pieces related to the roadmap that may be helpful also on our website, which is alz.org/publichealth/Indian Country. That's another place where you can find the roadmap for Indian Country. We have a handout about the 10 warning signs that Dr. Winchester had covered early in her presentation. And you can get, again, there's the links to the CDC infographics if you're interested, tools and examples. This webpage also provides links to not only to the 10 warning signs, a handout that may be helpful in terms of your community outreach, but also there's a publication that Wake Forest University developed that has a star there, and there's also a video that Wake Forest University created that is 30 minutes long. Wonderful tool to help educate your community members and get some conversation going. So wanted to point that out quickly, and back to you, Carolyn. Thank you.
Thank you, Molly. So I really appreciate the presentations that we just heard. And just to recap a bit, we heard from Dr. Winchester and Dr. McGuire, and we covered signs of dementia, what does dementia do, kinds of dementia. We heard from Dr. McGuire a bit about the Healthy Brain Initiative and specifically the work that was done to create the roadmap for Indian Country. We shared some data points and also some examples of tribal work in the space. I thought it was very interesting how we learned about one tribe's work to become a dementia capable community. Thought that was very interesting. And we also Lisa shared with us tools and materials that CDC has that are free and available to the public. In terms of takeaways, I did want to kind of hopefully spark some questions and some discussion. We haven't gotten any questions in our chat box yet, but I hope that we do see some in a few minutes. I thought it was very interesting to hear from Dr. Winchester about the kinds of dementia, and that there are 3 kinds of dementia that are presenting more frequently in Indian country. I would love, if we don't get a question on that, I do hope that Dr. Winchester might take a moment and share a little bit about that information that she touched on in her slides. And also another takeaway that I think is important to mention is just the risk factor in Indian country, and that the rates of other conditions for Indian country are higher, and those conditions correlate with a higher risk for dementia. So I think that that's a really important takeaway. It's an important piece for us to be aware of. And even if we are not getting complete data from every community, every tribal nation, every region of Indian country, some of the data that we do have certainly points to the fact that we are going to see higher rates of dementia in those spaces. And that's something that I think policymakers in Indian country and policymakers in Washington really need to keep in mind as we work towards better outcomes for Indian country and better outcomes for everyone related to dementia and Alzheimer's. And then I think that it was also a very, very interesting slide, very interesting information that Dr. Winchester shared about inflammation and some of the connections that we are seeing emerge in that space. And again, I know that we don't have a question on that yet, but I would invite Dr. Winchester to share a little bit more about that and dig into that piece just a little bit more if she's able to. So with that, I'm going to go ahead and start the discussion portion, the question and answer portion. So Dr. Winchester, if you wouldn't mind, would you talk to us a little bit about some of those pieces and just dig in a little bit more deeply?
So thank you for that summary. I don't think I could have done a better summary of my presentation if I'd done it myself. So thanks for hitting up all of the very important high points, because that's exactly, what you did. And I appreciate your reflection on, some of the content that it is key, including, looking at the different kinds. It actually is important to get an accurate and early diagnosis and to know what kind of dementia it is. Getting an early diagnosis I mentioned the importance of that, but what I didn't mention is there are many other reversible conditions that can cause memory problems. So it's just another example of why really making sure that someone is getting in with the provider, getting in with someone who can do a good assessment and try to figure out what the diagnosis is, because there can be different treatment considerations and discussions based on what type of dementia it is. And you did mention those top 3 that we see in Indian country, and they're the top 3 diagnoses for types of dementia anyways. But there are other ones. I mentioned on that slide that I showed, the frontotemporal dementia. There can be some very serious abnormal behaviors that can occur with that, and personality changes, and sometimes there has to be a different approach with those. So I appreciate you bringing up that point and allowing me to mention that it is very important to make sure that you get an accurate, diagnosis for the type of dementia that you have.
Thank you. We appreciate that. And also, would you be able to share a bit more, because you touched on how inflammation is part of this picture. Can you share any more thoughts on that aspect?
Well, I don't know that I'm entirely sure what you're asking about in terms of information, how that.
Inflammation. You had mentioned that, well, this was it, you spoke about how diabetes raises the risk of developing neurocognitive disorder, and that the role that sugar plays and having a baseline level of sugar in the body. And I thought that the comment about inflammation was related to that.
Oh, yeah, sorry. I thought you were saying information, not inflammation. That's just because I can't hear. Yeah, sorry. So absolutely, I think that, and I mentioned I think this is going to play a bigger role. It's not just, in its relationship to diabetes and cognitive health, but also heart disease, autoimmune diseases. I think we'll see more and more information about inflammation and its role, particularly as it relates to our diets, because there's also research being done on kind of the diversity of our gut bacteria and flora and how that can also contribute to all these different disease processes. So I present that as that it's more complicated, that we may initially think. We used to just say, oh, it's sugar, it's diabetes, it's related to exercise, it's related to what you eat, it's related to your genes. Well, there are other, factors that we need to look at, and one of those is not just diet, but why is it that, your diet is linked to problems with your sugar and problems with your brain. So that's kind of why I like to bring that up. I want people to think about that and ask their, providers and community about that.
That's perfect. Thank you so much for addressing that. And I would like to invite you, if there are things that Lisa shared in her presentation that you think would be particularly helpful, for example, in the community that you serve. And Dr. McGuire shared a lot of really nice data points and some really nice materials. Are these things that you can imagine would be helpful in your community with your community members?
Oh, absolutely. I think this is why I'm so invested in this roadmap and was so excited about, helping to develop and use it, because I really want it to be user-friendly and something that people can look at among different levels, whether in your public health or your clinician or, a home health person, that you can look at this and say, oh my gosh, I could see how this would work here. And that's why I like it so much, because I can look at that and say, oh yeah, in Cherokee I can take these things back and show them, and I have used this as a teaching and conversation tool with our public health, administrator, to say, look, this is what's, happening, the attention being brought to it and the different resources that are listed in there. I have already taken things that are in this roadmap in terms of looking at talking points and those kinds of things, because I think sometimes that can be part of the issues. You're trying to figure out, how do I make people understand that this is important and that something needs to be addressed about it. And that's, one of the strengths that I think is in this roadmap, is it guides you and provides, tools and information on how to do that.
Yeah, absolutely. And actually, I will just share a very quick story. One of the things that the National Indian Health Board has done as part of our work and outreach is we have shared the roadmap for Indian country at a number of our conferences, and we have had a few webinars, and we have had a few in-person workshop sessions at our in-person meetings. But I loved one particular engagement that we had, and we weren't actually on the schedule to provide an in-depth look at the roadmap or to look at Alzheimer's and related dementias. We were at a meeting of tribal leaders, and their purpose was not to look at this topic. It was actually to look at payment systems for their clinics and hospitals. But we shared this information with them because we knew this was a really wonderful group of tribal leaders, and that they would take this information and bring it back to their communities. And they really appreciated the roadmap. They really appreciated the infographic, and they just loved it. And one of the comments that they said was that they could bring those materials back, and there were things that were in depth that people who were subject matter experts would get a lot out of, and then there were things that were kind of quick, one-page kind of takeaways that would drive the point home about how important this is and how this impacts generations and how it's something that we all have to be working towards. And I really consider that group of tribal leaders just to be wonderfully engaged in everything health and public health related. So that group, by them, sharing back their reflection that this was really good work that was going to help them in their communities, we felt really good about having a small part to play in that work. So I still do not see any questions, but I invite folks to please ask a question, share a comment, share something that's going on in your community. But while we're waiting on that, I'd like to turn to Dr. McGuire and ask Dr. McGuire, you mentioned that one of the reasons for creating the roadmap for Indian country, and specifically tailored for Indian country, was to ensure that materials were being used by tribes and by tribal populations. So I wanted to ask whether or not the agency has seen an uptick in folks reaching out for this content, if there have been requests for additional types of resources or information or data, and I'll leave my question there.
Well, thank you very much, Carolyn, for the question. When we developed the roadmap for Indian country, we really were not sure how much interest there really would be in the community about it, and we have received a tremendous amount to the extent that we are giving lots and lots of copies out. We've had to do another print run for the actual roadmap, but we are getting lots of interest, and I think the roadmap is achieving its purpose, which really the initial purpose was to start some of these dialogues and conversations within the communities. And we're happy to see that is happening, and we are very glad to facilitate it in whatever way we can do that and continue to do that. I mean, some of the requests that we're getting for roadmaps are hundreds of them, and we're doing our best to fulfill those. And our colleagues at ASTOS with those beautiful healthy heart, healthy brain materials have had to do multiple print runs as well too. So there is a demand and an interest, and we're doing we are very glad to be able to provide materials so you all can work with and serve the people that you work with, and we'll continue to do so.
Wonderful, wonderful. So I would like to actually yield the floor for a couple of minutes to my colleague, Carrie Joseph, at the National Indian Health Board. And Carrie is going to share a bit about what the National Indian Health Board has coming up, because we are actually doing some really interesting work this year, and I wanted to share that with folks on the phone and on the webinar. Carrie? Carrie, you might be on mute. I think we mentioned at the beginning of the webinar that we had a power outage at the National Indian Health Board. So, and that happened right before this webinar happened. So Carrie may not have.
Cases are on a fiscal year, so that can be a little bit confusing.
Oh, I think that might be her. Is that you, Carrie?
Hi, Carolyn, it's John Sheehan. I think that was, we're trying to figure out if it was a mute issue, but I think that was just feedback. So it doesn't sound like we've been unable to find Carrie at this point on the webinar.
Okay. Well, so I'm happy to share a bit of information. I know Carrie was going to go a little bit more in depth She has been our point person that has been working on the planning. But the National Indian Health Board is going to be holding a number of in-person action institutes this year in a number of different regions. We haven't actually, I don't believe that we have put together all of the dates and locations yet. I think that we are working with partners to identify those. But I did want to mention that we want to make sure that we take this information out to Indian country and meet people where they are and foster those conversations. And in some cases, you know, conversations really, at least initially, we have found that those conversations are very, very rich, and partnerships are created in a really nice way when we do those meetings in person. So NIHB is very excited to have that work ahead of us this next year. And I did want to just mention that, and that I hope that folks on the phone will help us share information once we have dates and locations selected. And I hope that you will join us for that dialogue and for that conversation and for learning about what are the next steps that you want to see us take, the National Indian Health Board and our various partners in this work. So with that, I'm going to go ahead and turn it back over to Molly. We are a little bit over our time here, but I know Molly has a couple of things to share to wrap up and close us out. And I thank everyone on the phone for their time, and I invite you to reach out to the National Indian Health Board if there's anything that we can help you with, information that we can share, or just to be a navigator to information that we have touched upon today. Thank you.
Well, thank you so much, Carolyn, and so delighted to be able to partner with the National Indian Health Board. And I do want to thank our wonderful presenters, Dr. Winchester and Dr. McGuire. It really was terrific to be able to have both of you talk about, you know, how Alzheimer's and other dementias and caregiving for people living with dementia is starting to impact Indian country. And some different resources that are available for tribal leaders in order to help start the conversation about what your own local, you know, best response at this time can be. So thank you to our wonderful presenters. But especially I want to say thank you to everyone who joined us today. It was wonderful to have be able to have you come and join us and listen to the presenters. We do welcome your input and ideas, suggestions, and your questions afterwards. But we do hope that you'll take a little bit of time. I'll send this link out to you with the recording later this week. But please take a couple minutes and give us some feedback on this webinar so that we can know what else might be helpful, what was helpful, and what was less useful about this webinar. We do want to be able to continue and hopefully serve you well. And just to conclude, this is 2 websites to go and access some of the information and the resources that you heard today. Again, thank you, everyone. Hope you have a wonderful rest of your day. Thank you. Bye-bye.